HIV, Ebola, and COVID are just some of the infectious diseases that have kept doctors up at night recently and over the decades. Coming up on today's Morning Medical Update, we look at the progress made to treat all of these, and it's World AIDS Day. From dying to thriving with this disease, our guest shares his personal story and how we can all help break the stigmas. Good morning. It is Thursday, December 1st. I'm Jessica Lovell. Welcome to the Morning Medical Update. We are live inside the Dulcie Simons Jr. Family Broadcast Studio. Right now, more than 1 million people in the U.S. are living with HIV. But the CDC reports around 13% of people with HIV don't even know they have it. Today, our expert panel looks at the barriers to HIV testing, prevention, and access to health care. Plus, we'll discuss the past 2.5 years of COVID, monkeypox, and other infectious diseases swirling here and around the world. So make sure you get your questions sent into us. Right there are the links to YouTube, Facebook, and the Medical News Network. We'll get to your questions here in just a bit. Our panel, though, of guests today include Medical Director of Infection Prevention and Control, Dr. Dana Hawkinson, along with his colleagues, infectious disease physicians, Dr. Matt Shoemaker and Dr. Wissam Elatrouni. But I do want to start with Todd Gregory Gibbs. Todd, good morning to you.
Good morning.
Well, first, just thank you for being here with us and truly being the face of courage and survival through the darkest days of the AIDS epidemic. You were diagnosed with HIV 30 years ago. You developed AIDS back in 1995. Todd, what do you remember most from those early days of AIDS? You had mentioned to me that you lost count of the funerals that you attended.
Yeah, we had just come through the 80s with the abysmal response of the Reagan administration and the Bush administration to the crisis. And before I was infected with HIV, I had many friends who I watched deal with the disease and ultimately die. And so I had seen dozens of friends, dozens of people, mentors, teachers, boyfriends, friends, basically just wither away and disappear. And I think what I remember most from that time period was the despair. Mm-hmm. There just wasn't any hope.
So tell us what it was like when you first heard the news that you too were HIV positive.
Well, I was terrified. I was embarrassed. I was scared. I knew a lot of guys whose families basically disowned them and ostracized them. And I was really, really lucky that I didn't have that experience. My family was very supportive. But things weren't good. In 1992, when I was diagnosed, it was still a death sentence. And walking around with the expectation of being dead within a couple of years, I didn't expect to see the year 2000. Walking around like that is difficult. It's a challenge.
It's something I can't imagine. I'd asked you, Todd, when we spoke, I said, do you have just any photos of you just throughout the years over the last 3 decades, just so we could kind of help tell your story and kind of go back in time? And you said, you know, you're like, Jess, I didn't think I'd be alive. I didn't think there were going to be any memories to even keep. Why take pictures? Why have anything around?
You know, and beyond that, even I spent every cent I had in expectation of not having anything to, pass on. I lived with the expectation of being dead, and I had watched all of these gentlemen who were really close to me. I had watched what happened to them, and a lot of it was really gruesome, and I expected that to be my fate.
Dr. Hawkinson, I want to bring you in because a diagnosis today is certainly much different than it was 40 years ago. Why?
Yeah, I mean, certainly in the resource-rich countries, there are still vast valleys between resource-rich and resource-poor countries, but even there it is getting better. But in general, there are significant differences. Number one, it's getting tested early. And number two, also being able to do the genome sequencing very quickly to understand any resistances now, resistances to the medications that we have. And that is the main thing that we have seen that has increased survival, is that specific retroviral therapy, that highly active retroviral therapy used in combination. But now those medicines, before it was multiple pills multiple times a day, now we have excellent medications just being one pill a day that can really save a life and continue to have people have a great quality of life as well and keep them healthy.
I mean, Dr. Shoemaker, just the conversation with a patient being diagnosed today would have to be so much different than if you were a doctor 4 decades ago, right?
Oh, yeah, totally. I explain to people that if you come to your appointments and you take your meds, you should expect a normal life expectancy. And you're going to be just like me, and you're from the Midwest, you're probably going to die of a heart attack. So, stop smoking, get your screening colonoscopy, wear your seatbelt, take your meds.
This doesn't have to be your fate, right, Dr. Alatrini?
Correct. Yeah, definitely. Now with the availability of 30 or more medications for HIV, there's plenty of options to treat even resistant virus. And fortunately, resistant virus is becoming less and less common. As the treatment available now are so effective, people are taking them, have suppressed viral load, and do not transmit. And that definitely makes it much easier to control the disease, even though it's not cured. It's a chronic condition that people are going to live with, but it's controlled, just like high blood pressure or diabetes.
Todd, compare healthcare access for HIV patients then and now, what you're hearing now.
Oh, it's a completely different world today. It's almost unimaginable to have these medications and have the expectation of living a normal life, a normal lifespan.
What kind of medications are you currently taking? And then I want to ask our panel about what's available.
Well, I've been on a number of different regimens. I think one of them I was taking 18 pills a day, and that was back in the 90s. Today I'm on one of the quad medications that combines four medications, and some of those are Stribild, Genvoya, Biktarvy. I'm on a medication called Triomec. It is a little easier on my kidneys.
Dr. Shoemaker, tell us about long-acting injectable meds.
So as Todd pointed out, he went from taking 18 pills a day to one pill that has 4 medications in it. We've evolved even further. Now we have an injectable medication, which is 2 medications combined that people can take after getting their initial 2 doses 4 weeks apart. Then they get it every 8 weeks, and it is very potent, but it's only for those people who have already become undetectable.
So you say undetectable equals untransmissible. Tell us more.
So for a long time, we were still concerned about people being able to transmit the virus even when they were undetectable, but there's been a number of studies now that have demonstrated in couples where one person is positive and one is negative, if the positive patient takes their meds and is undetectable for greater than 6 months, it is essentially untransmittable in those patients.
So fair to say treatment is prevention?
Absolutely.
Dr. Alatrini, how has access to health care and treatment and the medications just improved? Where have we come from in the overall, in the last 4 decades, and then what work still needs to be done?
Yeah, definitely immensely. There have been improvement in access to care. Worldwide, over the last decade, now there is 75% of adults with diagnosis of HIV are on medication, and that's 10 times better than just 10 years ago. Access to health care, these medications outside the rich countries are available for a steep discount. And so, since the majority of patients with HIV worldwide are in sub-Saharan Africa, a lot of these get their medication from societies and donors from rich countries, and these are generic form of medications that are available. Now, in the US and rich countries, there are insurance companies that cover, even though the medication are more expensive in here, they are covered by all kind of insurance available, and even people without insurance are covered by the Ryan White program. So there's no reason a person now with HIV in the US or worldwide to not have access to these medications.
Well, and I wanted to ask you that because you had mentioned the Ryan White services here in Kansas City, Missouri. Tell people about that and the AIDS Drug Assistance Program, ADAP.
So the Ryan White program is a case management service named after a child, Ryan White, who contracted HIV through transfusions because of hemophilia, and they provide case management services to ensure that people stay engaged in care and provide non-medical services, transportation, housing assistance. In conjunction with that, there's something called ADAP, the Age Drug Assistance Program, where you can get your medicines covered through that program as long as you stay engaged with your healthcare provider and the Ryan White case manager.
So why does this disease, this is a question that comes up a lot, why does this particular disease continue to evade a cure? What makes a cure so difficult?
I mean, I think that has to do with the nature of the retrovirus, right? And I know there have been numerous attempts at coming up with a vaccine for prevention, and they have all failed at this point. So the other thing is the deep viral reservoir within our what we call fancy the reticuloendothelial system, basically your lymph nodes and tissues like that, that we can't seem to completely eradicate it.
Dr. Hawkinson, what can you add to that? I mean, are we at a place where we're continuing to look for that cure, or are these advanced medications kind of where we stand right now?
You know, I mean, I think cure can be defined in several different ways, but to Dr. Shoemaker's points, yeah, I mean, let's start with prevention. You know, vaccines have been hard to come by. We've been trying to create a vaccine since this virus was identified. The problem with this is just like on the spike coronavirus, on the coronavirus spike, we know that HIV has a spike, but unfortunately that is well shielded by sugar residues. It's hidden from the immune system, and it also has a high mutation rate, just like SARS-CoV-2. And so it is able to change quite frequently as well. So your body is always having to try to keep up with this virus that is staying one step ahead. And also, the unfortunate part of this virus is that it does integrate into your genome. It actually integrates into your DNA. So once it's inside the cell, it's basically game over. So you need that utmost optimal protection. We just haven't been able to obtain that from the current vaccines at this point in time for those and other reasons as well.
Todd, you've lived with this disease for 30 years now. How have the advances in the treatment and medication, how has it impacted the way that you've been able to live, not die from the disease, but live with the disease?
Quality of life is has been affected hugely. I'm not sick all the time. I'm not in perfect health. I still have chronic pain and chronic fatigue issues and things like that. But my longevity, of course, has been affected. Like I said, I didn't expect to see the year 2000, and here it is 2022. Psychologically, I think having that specter of death always hanging over me, having that gone has been a huge benefit. And just like socially speaking, the stigma has lessened. Although the stigma still exists around HIV in a lot of ways, it's lessened considerably. And people aren't ostracized and alienated the way they were before. And I think the understanding that HIV is doesn't have to be a death sentence. I think the understanding of that has made a big impact on my life.
Well, and I want to bring up some photos that you had sent to me, because you are living your life just like the rest of us. You have your husband, you and your husband, what's his name?
Jeff.
And you also sing. You were a music teacher. Are you still using music therapy, if you will, to kind of incorporate into your life and how you make it through?
I performed off and on with the Heartland Men's Chorus for the last 31 years. I'm not performing currently because of some back and neck issues, but I've also been off and on. I've given voice lessons and piano lessons, and currently I do a lot of playing keyboards in the pit for community theater musicals.
Again, living with this disease, not letting it take from you. I want to ask Dr. Shoemaker and Dr. Alatruni, where are we falling short as a society as far as the stigma? We make advances, but we always have room to improve, right?
Yes, definitely that is true. And we follow what's called the spectrum of care with HIV, is how many people are diagnosed, how many people are linked to care, how many people are on meds and suppressed. And we see in the US this fall from diagnosis linked to care to staying in care. And a lot of it maybe has to do with stigma, also have to do with access to care problems, maybe the relationship with the healthcare system. Maybe people are afraid to even do the first test to know their status. And that's the most important thing. because maybe they're afraid of how society will look at them. So that still is a barrier after 40 years that we'll have to normalize this diagnosis. So it's just like any other infection. Since it's not a death sentence anymore, we should break that
Well, it's
stigma.
so interesting because all of us sitting here in this room and Todd, we've all been living through this from the beginning to the end over the last 40 years. And so you're right, trying to change from what we knew, which we all saw happen. I mean, even when you mentioned Ryan White, I mean, those were some of my first memories of how society truly ostracizes people, even a child. And so what would you like to see happen? How do we really truly get past it and put it in the past and look at it differently?
I mean, I think it's become a lot more destigmatized over the years. I mean, you can watch the news in the evening, and you'll see commercials for antiretroviral therapy, which is pretty amazing because it's not something you would have seen. I think to Dr. Alatruni's point, the biggest thing is getting people tested, destigmatizing the language around HIV, and making sure people understand this virus doesn't care, who you are, who your partners are, or what your political affiliation is. It's just looking for a host. I mean, the other thing we see is it's in marginalized populations, people with mental illness, housing instability, substance abuse, and trying to address those things as well.
And Todd, you've been really open with your struggles with mental health. You said that you have worked to really manage those quite well over the years and the decades. What advice might you have for others facing a similar diagnosis?
It can be tricky because I think there's something like estimated 60 million people in the United States with mental illness, and only about half of those people even seek treatment. And if you do seek treatment, it's a system that's fraught with obstacles, and it's fragmented, and it can be expensive. If you're white and male, you're more likely to get access, and I'm white and male, and I did have access. I had some really great therapists that work with people with cognitive behavioral therapy, and I finally, about 10 years ago, I found a medication regimen that worked really well for me.
I'm going to put it, go, please.
I was going to say, like HIV, mental illness is, in most cases, a medical issue. It's a physiological thing. It's not a character flaw or a weakness.
Absolutely not. And we have a QR code we want to put up on the screen so that you can get more information, find more resources in our community for HIV and AIDS. So please click on that, pass it along. I want to show you a graph. You can see new infections fell, Dr. Hawkinson, 8% from 2015 to 2019. Why do you think we saw this drop?
I think it's just overall more availability of resources, but it's also the education. It is specific populations, but in general populations as well. Just education. I mean, there are so many social, as we've heard our guests say, there's just social directorates of all of these things as well, not just medical, but it's multifaceted, and I think it is not just one reason, but several, and especially those are the ones that I mentioned. And
during the pandemic, did we see a change in testing? Did that affect, Dr. Alatruni, I see you shaking your head.
Yes.
How did that hurt us?
I mean, as everybody was isolating and quarantine, there has been less access to healthcare, and the number of testing has significantly declined. You show the graph going down. Actually, if you look at 2020, there's a sharp decrease in number of new diagnoses, and we think that has to do with less testing. We don't believe that's actually a significant drop in new infection just because people were not testing as much during the pandemic.
Dr. Shoemaker, we saw that 8% decline. How do we continue with that trend?
Well, I think we have to continue to test, and then when we're testing somebody and they're negative, then we have to say, well, this person thinks that they're at risk for HIV because they came in for a test, so then we have to counsel them about safer sex and about PrEP. We know that PrEP is becoming more prevalent, and PrEP is pre-exposure prophylaxis, where we put people on an antiretroviral medication to prevent them from becoming infected. And it's highly effective, over 95% effective in preventing infections through sexual transmission. So, if somebody feels that they're at risk for HIV, they should talk to their healthcare provider about getting on PrEP.
And keep testing.
And keep testing. You got it.
Mm-hmm. So we've got a couple really good questions regarding HIV and AIDS. I'm going to get to our community questions, but I do want to get a quick check with Dr. Hawkinson while we're talking about COVID. Let's get a check on those numbers this morning. How are we looking there?
Yeah, steady numbers as far as active infections in the hospital. 25 active infections, 3 in the ICU, 1 in the ventilator, and 14 in that recovery period. So unfortunately, we still do have people in the ICU with this, but the overall number of hospitalizations is staying steady. But again, we also have to combine that with, as we talked about yesterday with Dr. Stites, the sharp increase in our influenza hospitalizations as well. Luckily, it seems that our RSV hospitalizations have decreased from where they were last week, but even this week, I think on Tuesday, I had 2 influenza consults of patients in the hospital. I had an RSV consult yesterday, and I do have a COVID consult today. So they are still happening. The virus is still circulating, but you know, we've got to wait and see, and hopefully everybody will get their vaccines.
Okay, we're hearing about this triple-demic, this tridemic, COVID, flu, RSV. Last week, the health system had 37 COVID admissions. During the same time period, it had 42 admissions with the flu, and 4 of those were kids. So, docs, what do we normally see this time of year?
I mean, this is pretty early. I mean, a typical influenza season peaks in January, February. So this is really early. You know, we've been worried about this after COVID. With some changes in the patterns of circulating viruses. You know, one thing that folks need to know is that the most effective prevention for influenza is vaccination. There's a Tamiflu shortage worldwide, so treatment for influenza is going to be impacted by that. So strongly encourage everybody to get their influenza vaccinations as well as their COVID bivalent boosters.
Dr. Alatridi, I don't know if you get asked the question because I'm a parent, and so RSV is now because, you know, last year it was COVID, year before it was COVID, now this year it's I'm asking more about RSV for my kids in school. What are the concerns there as we head deeper into the winter season?
Yeah, RSV has been the most problematic virus around so far this season, and it's mostly a virus affecting children and older adults who are immune compromised. The same precaution is for respiratory virus, so similar to COVID, similar to influenza. People who are sick should not go to school, not go to daycare, should stay at home. A lot of hand washing, cover your cough and sneeze, alcohol gel, and sterilize high-touch surfaces is going to be the standard recommendation.
Because this is putting kids in the hospital, and that is really concerning. How close are we when it comes to a vaccine for RSV? Who wants to take that one?
So there are 2 that are at the FDA for review. There is a Pfizer vaccine that has been studied in pregnant women and had shown more than 80% protection of the newborn baby within 90 days of being born, and about 70% protection up to 6 months after birth. So this is similar to the pertussis vaccination that's given to pregnant women to protect their babies. It seems like vaccinating pregnant women for RSV is protecting the babies as well. So that is a vaccine that is at the FDA being reviewed. There's no currently available RSV vaccine yet, but wait and see, maybe by next year we will have. And there's a GSK vaccine that's also been presented data at the ID Week this year that showed protection in people 60 years or older with comorbidities, again in the 80% protection from pneumonia and severe disease. So I expect one or both of these vaccines to be available soon.
Yeah, I think that's right. You know, I'd just kind of like to piggyback on that. I think to Dr. Alatrini's point, we are really looking at the very young, so those under a year, and if we can get pregnant moms vaccinated with this, if it is approved, that is going to go a long way. And then, of course, it is the elderly as well. And so we are really looking, because it is affecting the elderly quite a bit as far as hospitalization goes as well. And I think that is extremely important to understand. We are optimistic that by maybe this time next year, that will be available.
Monkeypox, now known as Mpox, has been around, but we didn't really hear about it until this outbreak this year. Dr. Shoemaker, why is that?
This is the first large outbreak with ongoing human transmission. There was an outbreak in the Midwest in, I believe, 2004 related to pet prairie dogs from an exotic pet shop. But this one seems to be clustered in men who have sex with men and started in Europe. It's worldwide now. You know, the biggest thing for prevention of this is getting vaccinated. We have a very effective vaccine that you can get for monkeypox. We have it here at KU.
Check with your doctor to get that.
Check with your doctor, see if they have it. If not, they can reach out to KU, and we have a number of clinics here that give that.
Thank you for reminding, because that's a vaccine people may not know is available, but it is available, and if you think you're at risk, please get it. Reach out to your physicians. Dr. Hawkinson, Uganda has been struggling with an Ebola outbreak.
Yeah.
There has been one in the U.S. in the past. It's been a while, but what concerns us about that, and how soon after you see one on the other side of the world that you could possibly see one here? Any dangers to that?
Yeah. Again, remember, I believe it was the Democratic Republic of the Congo outbreak, or over the Guinea, I don't remember which one. We did have a case or two that was in the United States. It wasn't a full outbreak in the United States, let's be clear. In Uganda right now, yeah, it is certainly important because we have seen cases and the large outbreak in a major metropolitan area as well. Luckily, they have seen a decrease in the velocity of cases. I think November 29th, I think they had their first case for 11 days. So I think that was good. I think we are seeing a slowing, and that is always good. But to your point, we know that really other countries, the other side of the world, is just a plane flight away. We need to continue to be vigilant. All countries do, to be watching. We know we have screening processes here in the United States, and even here at the health system, we are actively preparing for Ebola and other emerging infections as well, to be able to triage and treat those patients, and mostly keep other patients healthy, and our employees as well.
I want to get to some of our community questions if we can this morning. Kim has a question. What are the odds of getting AIDS or HIV from blood transfusions? We know that's how Ryan White got his, and we know people have gotten it that way. How is that prevented in health systems?
I mean, I think in 2022, the likelihood of getting HIV from a blood transfusion is exceptionally small. All blood is screened, and they have multiple screening processes they do for blood, and if someone screens positive for HIV, then that blood is thrown out after a multi-stage process. So I don't think that should be a concern
for anybody
in 2022.
Donna asked, do all countries have the Ryan White program? Is it administered through state health departments?
So it's a federal program that is then administered through the state health department. The coverage for the Ryan White program will vary from state to state. Each state sets its own formulary, but it's a federal program that is in the United States.
Sadie wants to know, Dr. Alatruni, I'll ask you, any current trials for HIV patients that you are aware of?
There are always trials going on for new medications for HIV. There's also, I know there was a mention about cure research, so there are studies going for HIV cure research as well. I want to say every year there are about 2 to 3 new medication in late stage development, and about 1 or 2 medication approved for HIV yearly. So there's always continuous trial going on. We don't have currently active trial recruiting at KU, but we recently finished the SOLAR study, which was studying the injectable, long-acting injectable medication called Cabenuva. But there are also prevention, PrEP studies going on looking for implants, long-acting, just like contraception, that might be successful and approved, hopefully.
Todd, were you presented with trial opportunities through the past decades?
Yes, but I didn't participate.
I want to ask, Bob wants to know, what are you watching closely as far as other infectious diseases? We've come out of this pandemic focusing on COVID so much, and we just talked about several, but I just want to go around and find out, is there anything on the horizon that's concerning you, keeping you up at night? Dr. Shoemaker, I'll let you start.
Measles.
Okay.
I mean, there's been a measles outbreak in New York in unvaccinated populations, and we know that even before COVID there was vaccine hesitancy, and that seems to continue. So we worry about the emergence of these childhood diseases that most of us, I've never seen a case of measles, most of us have never seen in our lifetime. So that's a big concern to me.
Dr. Alatruni, what concerns you?
I mean, what we've seen is how bad coronaviruses are, so I'm concerned about a new one. Or, avian influenza has been on the radar for a while. It just didn't materialize, but it's a respiratory virus that can transmit just like coronaviruses. So whether it's avian influenza or a new coronavirus would be my concern.
New variants, measles. Dr. Hawkinson, what's concerning you? What's on your mind?
I think we need a whole show just on that. I would echo what my partners say. Obviously, measles is important. We hear about micro outbreaks all the time in areas of the United States. Mostly they are imported, but to Dr. Shoemaker's very excellent point, there has been such a reduction of vaccine uptake for vaccine preventable diseases. It's so vitally important to continue to endorse and really get you vaccinated, get up to date with vaccines. Get your children vaccinated to prevent these things. And to Dr. Alatruni's point as well, other emerging coronaviruses, I think that goes to the bigger picture of climate change, changing vectors, which are things like mosquitoes that are now moving to places where they haven't been. We have things like Zika, which we saw a couple years ago. We know that other mosquito-borne illnesses, viral illness such as dengue and chikungunya, can make its way to places where they haven't seen, including the United States. So there are just a number of them. It's due to multiple factors, but those are things that we have to continue to be vigilant about. And to Dr. Alatruni's point, continue to monitor for spillovers. We need very good infrastructure in the public health setting, in the science setting, the surveillance setting, not only here in the United States, but around the world as well.
Chikungunya.
Yeah.
Okay.
You don't want it.
I don't want it.
It's hard to say, and you don't want it.
Don't know how to say it, but I don't want it. Okay, thank you. That is interesting to know. We're gonna follow up on those as time continues. I want to get to our final thoughts, and I do want to start with Todd. And Todd, I already asked your permission to ask you about this epic beard. And the handlebars. I told you I showed our pictures. We were getting our pictures together for our show, our program this morning, and they said that is awesome. You said it's just a beard. I'm like, that is not just a beard, my friend.
I hate to shave. That's it.
How long did it take you to grow it out?
Oh, not long.
Not long.
It was pretty fast.
Okay. Well, we love it. And you said something at the beginning, Todd. First of all, I just can't tell you how much we appreciate you sharing your story. You said that you were embarrassed when you first got your diagnosis, and I'm here to say you are a man to be respected and appreciated, and you are a friend of our show, and we appreciate it very, very much. So thank you for sharing your story and just continuing to get the word out and being the face of this disease that people are now living very well with, and you're one of them. So thank you. Final thoughts. What would you like folks to know?
I think the biggest thing for me is that HIV/AIDS is not over yet. There are a lot of us who were diagnosed before 1996 who I consider long-term survivors, we're still out there. A lot of us have emotional problems and physical problems, and are still, a lot of us have had to live in poverty for the last, 20, 30 years. And I just would like for us to not be forgotten.
You are not.
On this World AIDS Day, by the way.
On this World AIDS Day, you are not forgotten. Todd, thank you very much. Dr. Shoemaker, your final thoughts today.
Get tested for HIV and get your flu and COVID shots.
Dr. Alatruni, final thoughts.
Again, echoing, and thank you, Todd, for sharing your story with us. This is inspiring. And I think peer support is very, very important. So thank you for sharing your story and reaching out to the young generation and telling them how important it is to get tested, how things have changed, and how access to care should be easy and available now. So get tested if you don't know your status, and know that there's help.
You said it. Todd's a great example for the young generation to look to, live with grace, and we appreciate that. Dr. Hawkinson, final thoughts.
Yeah, I get to jump on all of our guests' thoughts, echo Todd's thoughts with, it is not over, just as he said. In 2021 alone, 650,000 people died from AIDS. There are still 38 million people living with HIV right now, so it isn't over. And that goes into Dr. Alatruni's point. We need to increase access to care, continue those infrastructure measures to be able to get that, because we know that, just as Dr. Shoemaker said, when you come to your visits, when you're taking your medicines, you're going to be healthy. When you have a healthy society, you have a productive society, and that is much better for everyone. And then to piggyback onto Dr. Shoemaker's point earlier about vaccines, and his last point, get your vaccines. Not only COVID and flu, certainly those are most important right now, but just as he said, measles, we always see outbreaks of that. Please go get those childhood preventable vaccines. Measles, mumps, rubella. Remember, if you haven't had a tetanus shot, get your tetanus booster. That also includes a whooping cough protection as well, which especially for people who are adults, we need that because we do lose immunity and we typically give it to the children. So there are just a number of vaccines. Talk with your primary care physician, talk with your pharmacist, be up to date on your vaccines. That will help keep you healthy as well.
Thank you to our entire panel today and this really important conversation. All Things Heart, though, is coming up at 10 a.m. Host Alexis Del Cid joins us now with a preview of today's program. Good morning, friend. How are you?
Good morning, Jess. We have a great show for you. You're going to meet a man named Jim. Jim was so sick with heart failure that his doctor said he didn't even know how Jim was still alive. To put it bluntly, he needed a new heart badly. But at almost 74, Jim's age wasn't considered ideal for a transplant. That is, if you were only going to look at Jim's age. The cardiologist you're about to meet wasn't about to do that. After looking at the whole person, he decided Jim was the perfect candidate for a new heart. And today, Jim and his wife, Marlene, could not be more grateful.
I don't know what the protocol is in this day and age, but I don't assume they're transplanting a lot of 74-year-old people.
I tell Dr. Shaw that he's Jim's guardian angel. And he told me at one point, don't say that anymore.
So coming up at 10 a.m., you're going to meet that reluctant guardian angel, the doctor who saw the person, not the number. And you'll learn why Jim was such a great candidate. And here's a hint. It was because of things we can all do, even starting just today. We'll see you at 10 a.m.
All right, Alexis, thank you so much. We'll be watching, and thank you, all of you, for joining us today. And as Todd mentioned, today is a day to remember those who have lost their battle with AIDS-related illnesses and those who live with it each and every day. So as we leave you, we look back at the 4-decade history since the HIV/AIDS epidemic began. Thank you for joining us, and we'll see you back here tomorrow at 8.
The lifestyle of some male homosexuals has triggered an epidemic of a rare form of cancer.
Says he gets very lonely. He misses his friends. The 13-year-old was banned from school after it was found he was suffering from AIDS.
AZT was tried as a means to prevent the virus from reproducing itself in the body's healthy cells, and it worked.
He died today of a respiratory illness related to the disease.
Quilt would cover more than 1.3 million square feet.
Coming up tomorrow on the Morning Medical Update. He's too sick to wait on the liver transplant list, so he's been in search of his own living liver donor. I'm Jessica Lovell. Coming up on the next Morning Medical Update, meet Gary, who has experienced setback after setback. Doctors will explain how his story is directly related to changes in liver allocation. See you at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now everywhere podcasts are available.